this notion of a 5-year plan is such a big idea, and one that we're borrowing from our building and construction, and something the legislature thought of a long time ago that has worked well for us. So, and the other thing, the reason we don't have numbers, and we're simply not there yet, but we're also trying to balance this thing called maintenance of effort. What is the responsible state support for public higher education in New York balanced against the tuition? So we're trying to get some principles on the table first.
But you would like some sort of an inflation type system where you could have...
I don't know whether, I guess what I would say is we are looking at the national average of tuition. And we don't have any aspirations to eclipse at some high rate what is typical across the country. And as I said, we're in the lowest quartile of state universities in view of tuition. And here in the Northeast, we're the lowest.
Did you ask the governor to include a tuition hike?
We did not. We have asked the governor to have conversations with us, but we did not specifically put forward the Empowerment Act of last year, but we're well aware that the executive branch knew that it had 3 legs to the stool, and we're delighted that they took on 2 of those issues. From last year to this year, 2 of a 3-legged stool being addressed in the executive budget is a breakthrough.
But just to be provincial for a second, the UB 2020 plan can't go forward unless you have that 3rd leg, right? I mean, that plan is dead.
Well, I don't think it's dead. I think you heard us say that public-private partnerships have a slower yield in revenue, but without it, we cannot do the downtown building and expectation that public-private partnerships intend. So it is not dead. It's alive 2/3 of the way, and that's really positive. So I'm a cup 2/3 full.
What seems to be the apprehension that someone had about the public-private partnership?
Well, I think people are concerned, rightly so, that we manage, first of all, we partner on things that fit our mission. That's really clear. They want us to do things that really feed what SUNY is all about. Secondly, they want to know where the risk lies, so we need good business plans. I thought the example of the dormitories was excellent. If you can't show us a good business plan for how many students are going to occupy that dorm, we shouldn't build it. And so I believe we can meet those expectations, and as I told you, or I said publicly, we've already had sit-down conversations about procurement, and they were very positive. And we have the unions at the table, as well as legislators from the Senate. Now Senator Laval intends to join the Assembly, and I feel it's all about modeling. If we can get procurement right, and then if we can get public-private partnerships right, we can get tuition policy right.
The governor was very explicit in his budget address. He said SUNY can absorb these cuts without raising tuition. I took that to mean that he wants no tuition increase this year. Doesn't your plan fly in the face of that?
I think it depends on when we'd start a 5-year plan. I think, again, the first step is to get the notion that we need tuition planning. And if possible, can we revisit this year, beginning sooner rather than later? But I think he had so many challenges to deal with. He's trying to sequence his work.
You talked about the impact of the
We'll get to Glenn here in a minute. I do have to get the chancellor up to the LCA by 11:30, so just take a couple more questions.
You talked about the impact of the hospitals, the teaching hospitals being devastating. Are we talking about closing these hospitals, particularly downstate?
I think it's very serious. I think it is not my role to say today this means closure. That's a frightening concept. We're going to try to understand, first of all, what this is, where it's coming from. The additional news today that there might be some glitch in the affiliation of downstate with the Long Island Community Hospital. That's news to us. We've spent a lot of time and a lot of people's investment, and the Department of Health and the Comptroller's Office, all looking at this very closely. So we're just adjusting even today to news we didn't have yesterday.
Well, do you think you'd have to close any non-hospital university, any of the other
Well, I'll tell you where we're starting. One of the values of SUNY is that it does touch all 62 campuses, that there is a SUNY within 30 miles of every New York citizen. So, and that they're major employers. So would we accomplish what we intend to accomplish by closing a campus? Maybe not. Maybe loss of jobs. But what we know we can do is consolidate back office services. I mentioned this in the State of the University address, and we're hard at that.